Turning now to a story that we have been tracking on the beat. New York Attorney General Letitia James, who's vowed to hold anyone accountable under the law, is exposing new and important problems in how New York State has been handling COVID and how it counts COVID-related deaths. And here's what's new tonight. A top aide to Governor Cuomo admitting to covering up the full picture of how people died of COVID in the state, including those who contracted it in nursing homes, citing the fear of basically accountability or a federal investigation. Now, Governor Cuomo has touted his COVID response. He also once served as Attorney General, the very post he's now clashing with. In response, he is saying there was some kind of information void, but he insists there's really nothing to investigate.
There is nothing to investigate. All the numbers we produced were exactly right. We didn't provide all the information that was requested. That did create a void, and misinformation did fill the void.
So there was a void. There was a problem with providing the information, and then misinformation filled it. This is the version of the response from New York State government there, from Governor Cuomo now. Of course, this may be a little striking to people because there was a period earlier last year when Cuomo became something of the national face of how to fight COVID. Now he's facing many calls to further investigate this part of the handling of the issue. And that same Cuomo aide was admitting that data was withheld because they feared the Justice Department would investigate, saying, quote, basically, we froze. And yet, it is not the federal DOJ right now, but rather the New York Attorney General I mentioned, Attorney General James, that is causing some of this new factual exposition, because she has been doggedly investigating and exposing more of how COVID was handled in one of the worst hotspots in those pivotal early months in New York. Now, so that you understand exactly what she found, she stated that Cuomo was, quote, vastly undercounting the death toll from nursing homes. Now, all of this matters because, as you know from following all of these issues since COVID first hit the United States, getting the right facts out, regardless of how they may affect politicians or government or anything like that, is essential. And in real time, it can shape the COVID response with, of course, lives on the line. In fact, Cuomo himself used to emphasize that kind of, quote, transparency when he did his briefings throughout the months and months of those early stages. And he became something of a staple through the daily press conferences and rounds of interviews.
Today is day 286. We're doing 3 COVID operations at the same time. Wear a mask. Today is day 100, and it is a day that New York City begins to reopen. New York State will mobilize an army. No state will do it better. You don't defeat a virus with politics. You use science and technology.
Some say that going on shows like Ellen, where she's pumping your head up with helium about how great you are, the cover of Rolling Stone, that you now, as we used to say in the neighborhood, think who you are.
To do Ellen's show was a pleasure for me. I'm a big fan of Ellen. Yes, she said nice things about me.
Yes, she did.
Which she didn't say about you,
Nope.
but she was just telling the truth.
You're feeling pretty good about yourself these days, aren't you?
Telling the truth. The issue here is that only full transparency appears to have come to the light under pressure. James' report, in fact, first came out about 2 weeks ago. We reported on it then. And what's striking is after this partial report revealed these problems with counting the deaths, then the state responded by actually changing the numbers of deaths from nursing homes. Cuomo had reported 8,700 nursing home deaths in late January. After the report, the number changed, rising quite a bit to 12,743. Updated numbers just last week bring the number to above 15,000. You can see the trend line there. So Cuomo's original numbers, we now know, because of this investigation, were off by over 50%. And what the Cuomo team was doing was basically trying to allocate deaths that occurred in nursing homes and related to contracting in nursing homes to hospitals. They were, according at least to this new aide, doing that on purpose to try to give an incomplete picture. Now, the Cuomo team has responded to the report. They basically say that it was an error of accounting. And they emphasize that when you get out of those individual categories, the total number of deaths did not change, which is fine. The total number of deaths were not at issue. What was at issue was the evidence of an allegation that maybe things were being deliberately misconstrued to play down the nursing home death rate problem. And the facts matter. Everyone needs facts, especially in a live emergency of a public health care crisis like this. And before this aide's admission, Cuomo was the one pressing on the numbers.
But who cares? 33, 28, died in a hospital, died in a nursing home. They died.
Who cares? Well, let's think about it. A.G. James' work stands out here. She previously was something of a political ally of Cuomo as a Democrat, but the release of this damning report does show that she has continued to make good on her dedication to be independent, which is what she promised.
In this state, we have a set of laws that every individual and entity must be held accountable to, regardless of who you are, regardless of your power.
Now, Cuomo is gearing up for a run for a fourth term as governor. This thorough report, of course, may or may not affect any of that. James appears, though, to be wanting to make sure that everyone gets the facts regardless. And she is standing up for the proposition that this matters. Her probe continues, and this brings me to that final point. Governor Cuomo said, who cares about the numbers? That is the kind of defense that can sound compelling, because you say, well, yeah, if the total number was right, who does care? But it's also a little bit of an incriminating defense, because if nobody cares and there were no differences, you could have released all the accurate category numbers to begin with. What it appears, and what people now from inside the Cuomo administration are saying is, who cares? They did. And they wanted to downplay the fact that there was a nursing home problem. This is common in politics because no one's claiming the Cuomo administration or any politician caused COVID. We all know we're living through this pandemic. COVID came to us and just about every other country. The question is, if you're touting your response and you're trying to do it right, and you find a mistake or a problem, and there's lives on the line, do you tell the truth about that? Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.